Heart failure. You've probably heard that term a lot, right? It affects millions of people all over the world. But honestly, it's a condition that's really misunderstood. So today we're going to break it all down, what it really is, how doctors figure it out, and the incredible progress that's being made in treating it. Okay, let's get into it. And let's just start with why this is so important. This number, this is the annual mortality rate for heart failure. So depending on how severe it is, the outlook can be pretty serious, which is exactly why getting a handle on it is so critical. When we hear heart failure, the name itself sounds final, right? Like the heart just stops working. But that's not what's happening at all. So what are we really talking about here? Here's the most important thing to get. Heart failure is a chronic condition. It means the heart is still working, but it just can't pump blood as well as it needs to. Think of it like a car engine that's lost some power. It's still running, but it's really struggling to get up the hill to meet the body's demands. And that inefficiency, it leads to a whole cluster of very specific signs. Someone might get winded just walking to the mailbox, feel tired all the time, or notice their ankles and legs are getting swollen. And that rapid weight gain, that's a huge red flag that the body's fluid balance is off.
Okay, so you have these symptoms. How do doctors actually figure this out? It's kind of like a detective story, really. A journey to track down the clues and get to the right answer.
It all starts with a conversation, just talking about your symptoms, followed by a physical exam. Then comes some initial tests, blood work, an ECG. But the big one, the test that really shows us what the heart is doing, is the echocardiogram. And this flowchart right here shows you that whole process. It's like a roadmap doctors follow. They start with the basics, your story, your initial tests, and if those look a little off, they move to that echocardiogram to see how well the heart's main pumping chamber is working. And that leads to a huge fork in the road. And that fork in the road, it all comes down to one single number. Seriously, this is the most important measurement they'll take, the left ventricular ejection fraction, or LVEF for short. It's basically a percentage that says how much blood the heart pumps out with every single beat. And this number, it changes everything. It determines the whole treatment plan. And here's why that number is such a game changer. Because it tells us that not all heart failure is the same. Based on that LVEF number, we can split it into two completely different problems. Okay, so on one side you've got HFrEF. That stands for heart failure with reduced ejection fraction. Think of this as a pumping problem. The heart muscle itself is just too weak to squeeze properly. But on the other side, you've got HFpEF, heart failure with preserved ejection fraction. This is a filling problem. The muscle is too stiff, so it can't relax enough to fill up with blood in the first place.
And what's so cool is how those simple analogies, pumping versus filling, translate directly into these hard numbers. If your LVF is 40% or less, bingo, that's HFrEF, the pumping problem. If it's 50% or higher, that's considered preserved, HFpEF, the filling problem. And of course, there's that little gray area in between. These numbers are literally the foundation of how we treat heart failure today.
So let's talk about how we fix this, starting with HFrEF. And honestly, the story of treating this pumping problem, well, it's one of the great medical success stories of our time. For years, the approach was to add one medication, wait and see, then maybe add another. But that's all changed. The modern approach is way more aggressive. The guidelines now say to start 4 different kinds of medication right away, all at the same time. It's called quadruple therapy. And these are the 4 pillars. Each one of these drug classes works on a totally different pathway in the body to protect the heart and just make its job easier. It's like a 4-pronged attack to relax blood vessels, slow the heart rate, get rid of extra fluid, all to help that weakened heart muscle. But does it actually work? Oh yeah, let's make it real. For just one of those pillars, the ACE inhibitors, you only need to treat 9 patients to prevent one of them from being hospitalized. 9! That is a massive impact. And it gets even more amazing. For beta blockers, another pillar, you treat just 19 patients and you save 1 life. I mean, come on, these aren't just tiny improvements. These drugs are absolute game changers, and they have become the standard of care for HF or EF. Okay, so that's the success story. But what about the other side of the coin, that filling problem, HFpEF? Well, that's been a much tougher puzzle to crack. And this slide just shows you the difference, clear as day. On the left, you see the super detailed medication-packed plan for HFEF. Then, look at the right. The plan for HFpEF has always been way simpler, mostly just about managing symptoms and other issues like high blood pressure. For decades,
The drugs that worked miracles in HFEF just fell flat here. But that story is finally changing. We've had a massive breakthrough. A class of drugs called SGLT2 inhibitors, remember, one of the pillars for HFrEF, has now been proven to reduce hospitalizations for patients with HFpF too. This is huge. It's the first real evidence-based therapy for this super challenging condition. Of course, treatment isn't just about what happens in the doctor's office. Not at all. Because heart failure is such a dynamic condition, the patient, well, you play an absolutely essential role in managing this thing day to day. This is where you can really take the reins. We're talking about things like cutting back on salts to control fluid and weighing yourself every single day to catch any fluid buildup before it becomes a big problem. Staying active, managing your other conditions, these are all key parts of the strategy that you control. And you know, there's a quote from the source material that just hits the nail on the head. It reminds us that heart failure isn't a one-way street. It's a journey with ups and downs. With the right management, people can have long periods where they feel good, where the disease is in remission, and they're just living their lives. Which really brings us to the big question, doesn't it? With treatments for both types of heart failure getting better and better, the real focus on partnership. How can patients and doctors work together using these powerful new tools and smart lifestyle choices to turn what sounds like a scary diagnosis into a totally manageable long-term journey?